Good morning, everybody. The topic of my presentation is to deliver a health education to elderly living in North District region in Hong Kong. And as I have introduced myself before, I'm a nurse working in intensive care unit. So every day I deal with figures and numbers such as heart rate, blood pressure, oxygen saturation, a lot. But I have a little chance to communicate and talk to patients because most of them are sedated, intubated, and paralyzed. But in fact, I love to communicate with the patient. So, do you know the temperature this morning? 10 degrees, 9 degrees, it's 8 degrees Celsius. So it's freezing. And it is the peak season of influenza as well. So, back to the topic. Why elderly is the target group? When the people get old, there are changes related to normal aging, include impaired vision, dry eye, hearing loss, impairment of memory or learning ability. Blunt touch sensation, especially near the tip of the fingers and toes, as well as blunt temperature sensation. So, when the temperature gets cold, elderly may develop a reduction in their body temperature easily because of the reduced ability in temperature control and decrease in subcutaneous fat. And the excessive loss in body temperature can lead to hypothermia. Okay. I can guarantee all of you have the experience of fever, right? But regarding to hypothermia, some may be unfamiliar. And in fact, recently there are press and reports about hypothermia. So what exactly is it? It is defined as a fall in the core body temperature to below 35 degrees. And in severe case, it can lead to irregular heartbeat, fall in blood pressure, total loss of consciousness, and the victim may be frozen to death. Okay, now it comes to the background of the health talk. It is a health program offering health checks and education on prevention of hypothermia. It provides ad hoc support during the cold days for the elderly living in the remote area of North District. And it is organized in collaboration with the Social Welfare Department and the non-government organization of North District. And also it is a joint activity of my hospital. And the volunteers include doctors, nurses, and allied health bodies from all specialties. And the content of health talk is to convey the message, to be alert of weather changes, put on adequate clothing, consume adequate food and drinks, keeps the home environment warm, appropriate activities such as remain indoors and in place with sunlight, and adopt preventive health measures such as have regular checkups, and encourage care and concern for elderly from family members and friends. This is a news the day before actually, that an elderly mistaken a warm pad from a drink powder. This is true, warm pad. So I think all of you know what is it. It is a warm pad. You open it and then it will get warm and you can keep your body warm. And elderly just take the powder and drink it and finally need to admit to hospital. It's true, it happens really. So, some elderly have knowledge deficits. We have to take extra care of them. And of course, we would take the precious opportunity to have the health checkup with the elderly, including measuring the blood pressure, blood for glucose monitoring, and give the shot of influenza vaccine as well. So to conclude, by this health education, I'm able to make the elderly they could take the opportunity to have the knowledge. And